I'm Dr. Russell Libby, and I welcome you to the world of medicine. You know, from the moment a child is born, we start thinking about those milestones that separate us from the rest of the animal kingdom. Of course, smiling and cooing are important, but it's nothing like those first steps. And of course, those first steps turn into walking, turn into running, and it becomes sort of a symbol for all the things we do in the world. We are able to get around, we go on fantastic journeys, and not only from a practical point of view, from a literary point of view as well. We hear the cliches, oh, you got to stand up on your own 2 feet. Oh, he's barely got a leg to stand on. Oh, there he goes again, putting his foot in his mouth. Well, our feet, our ankles, our legs, they get us around. And things that happen to them sometimes can cause some significant disability. And when that happens, our lives often get turned upside down. And it's really hard to appreciate until you experience them. Sure, we all have things like ankle injuries, sprained ankles, stubbed toes. Sometimes we might get more severe injuries, things that might be a fracture. Some of us, when we're chronically athletic, we might incur injuries that be like stress fractures and things of that nature. Sometimes we get inflammatory diseases, arthritis, rheumatoid arthritis, gout, things that will cause our joints to hurt and really disable our ability to walk. Now, some things can be very severe as well, things that require joint replacements, things that require significant surgical approaches. We're going to talk to a remarkable group of people who have very interesting stories to tell about what has happened to their legs, to their feet, to their ankles. And we're going to hear their stories and get the commentary of our experts. We have Dr. Matthew Buchanan. He's an orthopedic surgeon who specializes in the foot and ankle. He works at Orthopedic Foot and Ankle Center, which is brand new offices now just opening here in Maryfield, really close by the studio here. A phenomenal facility from what I can see looking at the videos of the new exam rooms. We have Dr. Iveta Borden. She's a podiatrist. She takes care of people with significant problems like diabetes and other kinds of skin and nail and different types of foot problems that really are important. Certainly diabetes, as we'll discover, is a very, very important condition that we need to talk about because there's so many people who are affected by it. And we have several other people from the office here. Matt Bernier, who's a physical therapist. He's going to tell us about some of the things they do to rehabilitate. And we have Marcia Graden, who is an orthotics specialist. She helps fit people with the kinds of things that support their feet and make sure that they can walk and give them the right kind of shoe wear. We're going to find out a little bit about our first. Cindy, you've had foot problems for a long time?
It was about a year before I ended up having surgery, but about 3 years ago I started having a lot of pain in my right foot, just only my right foot, and the right toe. Started out with not being able to wear certain shoes, and eventually the pain just got worse and worse till it really got to the point that every step hurt, and I finally decided I need to do something about this.
So this wasn't something that was bothering you from early childhood?
No.
It was something that sort of gradually evolved?
Right.
And the kind of pain you had was primarily in a toe? Mm-hmm. And that was your big toe?
Big toe in the ball of my foot area.
In the ball of your foot, okay. And how did that, it got worse and worse over time? You couldn't wear any kind of shoes that worked? At first you thought you could probably wear different shoes that might make things better?
Right, and busy mom, active, you know, I just kind of procrastinated and really didn't pay attention to it as soon as I probably should have because it got worse. And it just was painful all the time.
All the time. And what happened? How did you get diagnosed? And what happened
I went
then?
to my primary care physician who took an x-ray, and I had osteoarthritis in my big toe. And I knew Dr. Buchanan because I worked at one of the hospitals that he practices at, and so decided that I wanted to go see him, and that's what I did.
So you had the big name as that big foot specialist
right,
out there.
I knew he was good.
Yeah, okay. So at that point, were there options? Did you try things?
Mm-hmm. We did a steroid shot. And we did x-rays, and he told me I was kind of down to bone on bone in my big toe, and that's why I was having the problem. And I couldn't bend my big toe, so walking, you know, when you're walking, you need to bend your foot, and when you can't, and you're forcing that because you're, you know, putting weight on it, that's where the pain was coming from. And so we did a steroid shot, which helped for a little while I kind of thought about doing some surgery, and then ultimately did surgery.
So the surgery is what worked?
Absolutely.
Yeah. Well, we're going to hear a little bit about what kind of surgery you had. I'm curious, Because you say you have arthritis in a toe, and that's couldn't be an uncommon condition. It sort of evolved later in life where you were very active and athletic.
I was for a while. I ran, I exercised. Then it got a little bit more sedentary, but why it was just in one toe, I don't know.
Yeah. So you never remember injuring it, but you might have at some point or another. And the kind of pain you had, was it there overnight? Did it wake you up at night?
It did eventually, toward the end.
Towards the end. And then during the day would be how in the morning? And would it get worse through the day?
It would definitely get worse through the day as I was on my feet and walking a lot. It would, be a little bit less in the morning, but it didn't take very long for it to
So by the end of the day, it was up in the air. You had some ice on it. You were trying to do anything to make it feel better. It never got swollen significantly. Did it get hot?
Nope.
Never
just
got
pain.
hot. Just pain. It was mostly towards the end. The more you used it, the more it hurt. Okay. So that's a pretty classic story for arthritis. And I ask Dr. Buchanan, we have a pretty good story, arthritis. Yeah. Do we see it a lot in the adult population?
It's amazingly common, especially in the big toe. So it's a condition called hallux rigidus, and it's an arthritic condition that tends to affect younger, healthy, active patients. We see it a lot in our running population is a real big one, dancers. Anybody who does a lot of push-off, toe-off with their foot, it's actually surprisingly common.
Yeah. And what age do you start to see that? I mean, obviously you have genetic or injury predispositions, but on the whole, for those who aren't so predisposed?
You can see it as early as your 20s when it starts to develop, but typically the patients that were, performing surgery and doing injections and stuff on, 30s to, let's say, 50s. So sort of the prime of your life, and it can be quite debilitating.
It's very painful. And the first way you approach those things is with an x-ray, as she had described?
Absolutely. So we're going to make our diagnosis with a good physical exam. We see the stiffness she talked about, the pain with trying to move it, occasionally some swelling. X-ray confirms that loss of joint space, which is what arthritis is. And initial treatment will start off with maybe some shoe changes, some activity changes, maybe some inserts for the shoe. Will kind of be first line. Cindy, we ended up doing a cortisone injection for her, which helps, but a lot of times that's temporary relief.
So how long do those things work if you do end up getting a steroid injection? How long can they help you, and at what point do you know that this really isn't going to make the difference?
Typical positive response from a cortisone injection can last up to 3 months.
Okay.
So.
And then they come back for another.
Exactly.
And then they come back a little sooner for another.
Yeah.
And you say, we got to start to think about something else.
Absolutely.
Yeah. So you have a way to start and a way to look at it. So chronic joint problems that cause arthritis. Now, there are other types of arthritis, and she was describing what is pretty classic for an osteoarthritis, as they call it.
So we can see another very common form of arthritis we see in the foot and ankles, post-traumatic arthritis. So that's the athlete that in high school had repetitive ankle sprains that ends up with wear and tear arthritis in the future, 10, 15 years down the road. We do also see some types of inflammatory arthritis, whether it's rheumatoid arthritis or any of the other inflammatory conditions that can affect the foot and ankle. But most of the time it's osteoarthritis or post-traumatic.
And the inflammatory arthritis, those that are associated with certain autoimmune diseases, as they call things like rheumatoid arthritis, they have sort of a different presentation. I mean, obviously you have some family history possibly, but the way they experience the pain day in and day out and the effect on the joint and your perception is a little different. Tell us what you see that way.
Agreed. So like an inflammatory arthritis will be, the joint by the name will be more inflamed. So it's more redness, more swelling, it's more diffuse. So in Cindy's case, it was really isolated to one joint, and inflammatory arthritis many times will affect multiple joints. We're seeing, like I said, the redness. The presentation's a little different, where the wear and tear arthritis tends to be worse with activity, where the patient with inflammatory arthritis will wake up in the morning sort of stiff to begin with before any activity. So those are some of the diagnostic keys to, what's inflammatory arthritis, what's more the osteoarthritis, the wear and tear arthritis.